More than a month into the pandemic, a lot of people are still having questions about what's going on inside hospitals and if the situations are improving. Joining us this morning to talk about that is Dr. Harsha Ramchandani with Tri-City Health Center in Fremont. Thank you so much for joining us this morning, Dr. Ramchandani.
Sure.
Okay, so let's talk about, I know we spoke with you last month when testing was still limited, but we've seen, of course, more places lightening the restrictions when it comes to testing. We saw Bolinas, the town there, they're saying that everyone there can administer tests or have those tests. So talk to us about that. What does that mean when we're still expecting that peak with cases here in the Bay Area?
That's a real concern. I mean, testing it was restricted, of course, and it's still restricted right now. We do not have all the supplies that we can test each and every single person. So we are still screening patients. We are still asking them if they have symptoms, and then we are prioritizing the testing for patients. You're right. Some of the, like City of Fremont Fire Department, we collaborated with them to offer the free testing for each and every single person, irrespective of the insurance. But still, I don't see that happening for every single person at this time because of the less supplies that we have.
And the fact that we don't have a lot of testing or everyone can get testing, we're hearing more about lifting some of those restrictions, the shelter at home. From a medical standpoint, is it a good time to lighten some of those restrictions that we're seeing? Because we saw Ventura County down in Southern California, they lightened their restrictions over the weekend.
So as per Governor Newsom, 56% of the Californians will have this disease. So at this time, we are not at that number. And our projections are that we might hit a peak in May, or maybe in the end of May or early June. So I will be very, very careful in saying that we should lift the restrictions. We need to do the testing first. Contact tracing is also one of the important key steps that we should be looking at before lifting the restrictions.
And when we talk about that, I know asymptomatic, that is something we hear a lot. I know we just talked about a report this morning from Bob Riddell, one of our reporters, says 60 to 70% of military people there are asymptomatic. If we have a lot of people walking around asymptomatic, how does that affect us? Are we in danger, or what does that mean?
So the antibody testing that is we are testing right now is basically tells the immunity to a virus, which is a coronavirus, but it could have false positives also. So at this time, I think a lot of studies is needed to find out if the immunity positive, that doesn't mean that patients or the people are immune to get the disease, or does it mean that they were asymptomatic and had the infection and nobody knew it?
All right, and I know the governor has been giving updates about the hospital beds and ICU, as well as ventilators. As far as where you are, how are things looking with the number that we have available?
So the good thing with the shelter in place and social isolation, we have seen the reduced hospitalizations and the reduced ICU admissions and the deaths at this time in California, in the Bay Area. But it doesn't mean that it will continue like that if we loosen our restrictions. So we are getting prepared. We are getting prepared not just for the ventilators and the PPEs, but also for the personals in California and also for the beds. The volunteer list has been going on for people who want to volunteer, and they're working in the outpatient clinics, and they might be able to help us help in the hospital settings.
All right, Dr. Ramchandani with Tri-City Health Center in Fremont. Thank you so much for joining us this morning.
Thank you for having me.
More and more each month, we're into that pandemic, and many people, they're still having questions about what's going on inside of hospitals and if the situation is improving. Well, joining us this morning to talk about that is Dr. Harsha Ramchandani with Tri-City Health Center in Fremont. Now, Doctor, I know we spoke to you the last hour, and we were talking about asymptomatic. And the question I want to add to that, which we talked about, as we talked about, more people are showing the symptoms of being asymptomatic, 60 to 70% in the military. Is that something that we should be frightened of? Because these are people who have COVID-19, but they're not showing those symptoms. So should we be scared, or is it meaning that we might not get as sick as we thought we would?
So I would like to say that we need a lot of studies to show this, to prove this. Right now, the antibody testing that we are doing, it could be false positives. I'm not 100% sure about that at this time, but you're right. I mean, the studies are showing that there are a lot of asymptomatic patients, and how it will imply for future, especially for opening up the economy and opening up picking up the shelter in place, that's very, very important.
So give us insight of what's going on in your hospital. What are you all seeing? Are you seeing an increased number of people, or are we seeing it slow down just a bit?
So fortunately, with the shelter in place, we are seeing the reduced hospitalizations and reduced ICU using of the ICU beds for critical patients, as well as we can see that the deaths have been decreasing on a daily basis.
So, you know what? There are a lot of unknowns when it comes to COVID-19. We talk about that a lot. But what have we learned in the past 3 to 4 weeks? Because we're learning little by little about this virus.
That is true. I mean, this is something that we are all learning as we go along. So we did notice that, as you mentioned, there could be a lot of asymptomatic patients. So testing everybody, that could be one of the strategy that we should be doing in, or at least testing for more people than what we are doing at this time.
All right, Dr. Ramchandani with Tri-City Health Center in Fremont. We want to thank you so much for joining us this morning and giving us a little advice of what's going on.
Thank you.